Okay, chapter 16, patient education, right where we left off on part one. So when you're doing a needs assessment for learning, you're always looking at who needs to be there, who's going to take care of the patient at home. So that might be the mom, the grandma, the daughter, whoever needs to be there. You would save a lot of time if you had those people there teaching them at the same time so they hear the same message. Learning needs, so you've already identified what they know and what they don't, so that you don't have to waste time reiterating how to read a syringe on someone who's done insulin injections for 20 years. Knowledge level, same kind of thing. So where are they at? If they have a 6th grade reading level, that makes it a little different than a master's degree. Health beliefs and practices. So if they're not going to use the insulin because they feel that that's not beneficial or they don't ingest pork, that might be a problem. So you need to know all of these things. Their physical readiness. Are they physically ready? Are they tired? Emotional readiness. Are they ready to tackle this new thing in their life? So physical readiness and emotional readiness will come back to haunt you when we talk about ostomy training. The ability to learn. Are they even able to learn at this point? Are they in shock and awe? Health literacy level, again, like 6th grade versus 12th grade reading level. If you know somebody's at a 4th grade reading level, you're not going to hand them a bunch of brochures. They're not going to be able to read them. Neurosensory factors, are they neurologically able? So stroke, things like that. And then knowing their learning style. So we use VARC a lot in education: visual, auditory, reading, kinesthetic. So which kind of learner are they? How do they like to learn? And then our whole goal is that most of our nursing diagnoses are going to be up around deficient knowledge that they don't know. And then we are going to bring them into the realm of knowing. So planning outcomes, you're always looking for a learning contract or a teaching goal and your learning objectives. What's your objective in teaching them? What do you want them to be able to do before you get them home? So a clicker check. A client is given a pamphlet to read about how to manage their newly inserted central venous catheter device at home. It will be important for the nurse to assess the clients. So if you're giving them a pamphlet to read, what would you want to assess? We just talked about this. You definitely want to make sure that they don't have a vision problem. So if you're giving them a pamphlet, they have to be able to read and be able to see to read it, right? And then the components of the teaching plan. Typically, the teaching plans that we do are basically using a strategy. What strategy are you going to use? Is it a brochure? Is it a fake needle, syringe? What kind of method are you going to use? The content is what you're teaching. The scheduling and sequence is how much, because if it's a lot to learn, you want to scaffold it. You want to do it in small chunks. And then at what point in time do you come back and double check that they understand it? The instructional material has to be at the right level of information, the reading level, and the preferred language. So if somebody tells you they only speak Spanish, you need to have a Spanish brochure. Some examples of teaching strategies. We can lecture. It's usually not the best way. We can have a group discussion, return demonstration. We can have one-on-one instruction. Digital sources of information, so providing the TV channel to watch for it or a website to go to for it. Sometimes there's printed materials. That's good if somebody has trouble remembering because they can always reread it. Role modeling is when we give them a shot in insulin, we role model how they would do it, and then next time they do it. Online sources of information and the use of mannequins. So we use mannequins quite a bit in simulation, but that's what you would do. You would take them to a sim lab or bring the mannequin to them to be able to use. So just think about the last CPR class you went to. And then when you're evaluating learning, you need to double check that they understand. So that could be just oral questions, a checklist, a questionnaire. It could be direct observation. You watch them the next time they give their shot. The client reports and the client records. So when you have a new diabetic, they're going to eventually just bring their checklist with them. It might be a blood pressure list, it might be a blood glucose list, but we're having them bring back what they need to show us that they know what they're doing. And then tests and written exercises. Occasionally we'll use those as well. So just some Socratic reasoning here. Last couple slides. Your patient's an adolescent girl, recently diagnosed with type 1 diabetes. You develop a teaching plan for insulin therapy and diet management. While you're teaching, she is texting and not paying attention. What would be another way to teach her if she resists your approach? Well, if she's texting and not paying attention, perchance you're lecturing her like her mom. So maybe make it more of a team approach or make it a more interactive approach. Worst case scenario, if she's texting and she's using her cell phone, why can't you send her to a website? So just think about what would happen if she failed to learn to manage her insulin and diet correctly. She'd have a high blood sugar, she would be in DKA, diabetic ketoacidosis, and she would eventually become hospitalized for that. So it's a very real concern that if she doesn't know how to do this, we're going to be in trouble. What other ways are there to look at this situation? Another way to look at it is having someone her age come in and talk to her. So someone of another age group just like her. That might be a great thing, or a teen support group. So think about it. Sometimes you don't want your mom or your grandmother lecturing at you. It might be easier to bring somebody from a younger generation than you are to be able to get through to her. At the end of the day, we need her doing her thing. Otherwise, she will be doing the revolving cycle in and out of the hospital. This is also where teenagers get that they have control over their parents. So if their parents are trying to get a divorce or something like that, they may misinterpret their insulin regimen, not give their insulin or give too much insulin to cause an issue. So you'll learn more about that in mental health as well. There's actually diabulimia, which is a eating disorder in using insulin too effectively as for weight loss. All right, so that's it about patient education.